why is it so important to do this stuff? Why is it so important to really focus on being healthy right now, no matter what your age is, no matter where you are with your health? Because atherosclerosis, heart disease, the clogging of any of the arteries is a disease that starts early. The day you're born, your arteries are wide open, nice and clean. But as young as the age of 3, we start seeing fatty streaks building up in the arteries of the heart. And it's crazy. There was even one study that showed pregnant women who have massive cholesterol disorders, whether cholesterol numbers or LDLs are 300 to 400, in the fetus, they can detect fatty streaks in their arteries already building up in the mother's belly before the baby's even born. Atherosclerosis starts early. So the earlier you're doing all the right healthy things to protect your arteries, which we're going to get to, the better you're going to be. It slowly progresses over time. In the adolescence and into adulthood, you can, severely clog your arteries. But the big thing that we don't want is when that blood clot forms, suddenly, you could be fine one day, you could run 10 miles and everything's all right. And then suddenly that blood clot can form on an unstable plaque. It becomes ulcerated and your body thinks it's doing a good job healing up. It's like cutting yourself with a knife. It clots the blood thinking there's an injury, right? Well, your body thinks there's an injury on the inside of your artery. It doesn't know any different. It just thinks it's healing and it clots it off, obstructs the blood flow, boom, and you get a heart attack. So why is it important? I could just, once I get the heart attack, fine, then I'll start eating healthy, right? Nope, guess what? The first symptom in 1 out of 3 people with heart disease, the first symptom is they just die, sudden death, the first symptom. So you got to start early to prevent heart disease. The earlier, the better. So there are a lot of nuances in regards to heart disease prevention, but more than 90% of it can be summed up by 2 things. One is controlling your blood cholesterol levels. And the second is protecting your endothelium, the lining of the arteries, protecting it at all costs. So these are the 2 things that people really need to focus on for heart disease prevention and eventually reversal when you take it all the way to that level. So let's go into these 2 things just a little bit. So in regards to cholesterol, it is just so crazy important. There's a great article that goes over the importance of cholesterol. There's all these risk factors for developing heart disease, but which one is a prerequisite? Which one is necessary for you to clog your arteries up with cholesterol plaque? Only having an elevated cholesterol is a prerequisite. So if you phrase this a different way, in other words, if your cholesterol levels are really low, there is no evidence that smoking cigarettes, having high blood pressure, being diabetic, being a couch potato, or being morbidly obese will clog your arteries up with plaque. So the prerequisite is getting that LDL crazy low. There's interesting studies on people with genetic mutations in their different, CETP, different enzymes and such that have an LDL cholesterol sitting around 60 from the day they're born, no matter what they eat. And they could be obese, diabetic, and smoke, and they don't have heart attacks and strokes. Their LDL was 60 from the day they were born. So the sooner you get it down, the better you're going to be, which I'll show you in the future in a slide coming up here. So what can you do in the diet that lowers your cholesterol? Well, it's 3 things. Dietary cholesterol, if you eat it, it'll raise your cholesterol up. Saturated fats will raise it up, and trans fats will raise it up. Those 3. Trans fats are illegal now to add to foods, federal law, but it is still naturally occurring in many different animal-based foods. So if you go on a whole food plant-based diet, now you've eliminated cholesterol, you've essentially eliminated most saturated fats and trans fats. That's what you need to do to halt and reverse heart disease. Knowing your cholesterol numbers is so critical. You need to know it. Now, this is the standard numbers that you'll hear a lot of people say. Keep the total cholesterol under 200, the LDL under 100, the HDL, the higher the better, and then the triglycerides less than 150. But is this right? Is this the right numbers that we really need to be focusing on? Well, let's answer that question. Big study, Framingham Heart Study, which went over all these people in Framingham, Massachusetts, followed them for a long time, got all their different information. Guess what? About 1/3 of heart attacks happened in patients who had normal cholesterol levels, but their normal was perhaps not low enough. What we do know is there's this great publication in the Journal of the American College of Cardiology, probably arguably the most prestigious cardiology journal that's out there, that did a phenomenal job of explaining how LDL impacts your cardiovascular health and how the sooner you control your LDL cholesterol, the better you're going to be. And so here's a graph, and follow me through this here. It's so important to understand about your cumulative LDL cholesterol exposure. Some people call this plaque years. In the medical world, we have an expression for when people smoke cigarettes, 1 pack of cigarettes per day times 20 years is 20 pack years. Well, this is plaque years. And so the longer your LDL is high, the higher your risk is going to be for having an event like a heart attack or clogging your arteries up. So the average American, their LDL cholesterol sits at 125. The average American, by the age of 40, 1% chance of a heart attack if that's where you are. By the age of 60, 4% chance. And by the age of 80, there's a 16% chance that you will have had a heart attack if your LDL cholesterol has been the average, which is 125. Now, I have people coming in with LDLs over 200 all the time, but let's use the next number and let's just call it 160 LDL cholesterol. And let's see where that falls on this graph. Well, if you have an LDL of 160 on average, by the age of 40, you're at a 3% risk of a heart attack. By the age of 60, you're at a 16% risk of a heart attack. By the age of 80, you're off the charts in regards to your risk of having a heart attack, probably around 50% or so, right? Now, let's take it the other way. If your LDL cholesterol remains nice and low, let's say 60, by the age of 40, your risk is way under 1%. By the age of 60, still way under 1%. By the age of 80, your risk is still way under 1%. What a powerful thing just with LDL cholesterol control. So that was a great publication, and I think that really does a really powerful job of explaining the cumulative LDL exposure. The sooner you get it down, the better you're going to be. So we know some of this information from nutritionfacts.org, Dr. Michael Greger, Lome, check it out, How Not to Die. Great chapter on how not to die from heart disease. We know that the normal LDL should be between 50 and 70. And we know that neonates, are even lower when they're born, and healthy adult primates, their LDL should be between 40 and 80. So what's the heck with that less than 100 number that we usually saw? Well, that's not right. It should be lower, right? So here's a great publication that showed what we call primary prevention, trying to prevent the first heart attack, first stroke. And all these dots are actually clinical trials where they're using cholesterol, looking at events. For primary prevention, the LDL cholesterol where events approach 0 is around 55. Now, what if you've already had a heart attack or a stroke? This is secondary prevention clinical trials. If you want to get your risk to close to 0 after you've already had an event, the LDL needs to approach 30. It's crazy low. I mean, nobody ever tries to push it down to as low as 30, right? Well, there's suggestion that could be beneficial. So maybe we should change our ideal cholesterol numbers. It shouldn't be less than 200 for total. It should be less than 150. The LDL should be less than 70. Don't worry about the HDL. It's more the function of the HDL. And the triglycerides, sure, less than 150 sounds good, but that's a whole different discussion. So just to breeze through now, we said cholesterol, saturated fat, and trans fats are the biggest things here, right? So where does cholesterol come from in the diet? Of course, we know animal-based foods. It's not an essential nutrient. You don't need to eat any cholesterol to live. Every cell in your body can make cholesterol for you. And plant-based foods have absolutely no cholesterol. Many of you know that. So focus on the unprocessed plant-based foods. Many people don't know chicken and eggs are the number 1 and number 2 source of cholesterol in the American diet. In most surveys, beef is relatively high. People think I eliminated red meat, so I'm okay eating chicken, right? Nope, you're still going to have a lot of cholesterol in that chicken that you're eating, maybe less saturated fat, but you're still going to have a lot of cholesterol in that. Every time people think I'm eating healthy, right? I'm eating chicken and fish. No. Cut the chicken out. Definitely. No question. Even the fish has a significant cholesterol and some saturated fat content. Of course, butter is high in cholesterol, and look at the plant-based foods, none. Plant-based foods don't make cholesterol. Should we eat any cholesterol? So here's a statement. In the USDA dietary guidelines, which are flawed, the science is good, but their general end recommendations in the end are wrong in regards to their plate, which I'll show you. Here's a statement that they say, as recommended by the Institute of Medicine, which has since changed its name, individuals should eat as little dietary cholesterol as possible while consuming a healthy eating pattern. As little as possible. Well, that's 0, right? Should be 0. 0 cholesterol, please. So in regards to saturated fat, Saturated fat is fat that is probably more important than dietary cholesterol in regards to your LDL. Butter is very high. Cheese is the number one source of saturated fat in most people's diet here in America. Beef is very high in saturated fat, and that's one of the reasons why red meat has such a bad rap, that and the cancer risk, of course. Chicken is lower in saturated fat, and that's why, chicken's a little bit better for me, right? Well, it still has cancer risk, and it still has a ton of cholesterol in it, and it still has some saturated fat, right? It might not be a huge amount, but it still has some. And look at the coconut oil and the palm oil, extraordinarily high amount of saturated fats. And no, plant-based saturated fats are not necessarily any dramatically, different. They're still harmful to your health. And look at the plant-based foods, essentially no saturated fats in the plant-based foods, right? So here's the statement about cholesterol, about trans fats, saturated fat, and cholesterol in the diet. The Institute of Medicine did not set an upper limit, how much is safe for you to eat in regards to cholesterol and saturated fat, because any amount that you eat, any amount above zero, any bit, will raise your LDL cholesterol number. We know this based on what's called controlled feeding studies, where they locked people in, controlled everything they ate, and then monitor their cholesterol numbers. And we know that any amount of saturated fat, dietary cholesterol, trans fats will raise your LDL. So when people are trying to change their diet to get their LDL down, they should go to zero for all these things and see how far you can get it down to begin with. And it's similar to smoking cigarettes, right? You don't need to smoke cigarettes to live. Any amount of cigarettes is going to cause harm to your health, any amount. So it should be zero. You don't need to eat cholesterol to live. You don't need to eat saturated fat to live. It should be zero in your diet. So that is drilling in the point of how important LDL cholesterol control is and how you can get it down with diet. Eliminate cholesterol, dramatically reduce saturated fat as much as you can. And of course, the trans fats come down as you eliminate the animal-based foods.